Do you find the term medical provider as derogatory? I got this comment on a video I made recently because I talk about primary care a lot as a pediatrician, primary care pediatrician, and I use the word provider to try to include anyone who is providing primary care to that patient. Because I'm talking to a parent or a patient and I don't know who they're seeing for their primary care. In the state of Vermont, where I am, that can be an MD, a DO, a nurse practitioner, physician assistant, pediatrician, family practice, also can be a naturopathic physician. And so that includes a wide variety of people. And I want to make sure that I am inclusive because it's not about what I think about it, it's about making sure the patient understands what to expect from their primary care clinician. So the term provider has some negative connotation because it was set up by insurance companies, specifically Medicare, in the 80s and 90s as a reimbursement strategy. And when that started, we did start to notice a shift in medicine where anyone who was labeled as a provider sometimes would speak out of turn and would sometimes speak about things that maybe they shouldn't. And I do think that that has contributed to some of the decline in trusting experts. Because if someone is labeled as a provider, does that give them the expert advice to talk to you about your child's health if they are not a pediatrician, if they don't have training in pediatrics, if they don't have the same degree in licensures as an MD, and then specifically a pediatrician? So again, I don't have the answers to this. There's not a right or wrong way. It's just about listening to people, and I want to try to have inclusive language that makes patients feel comfortable with who's providing their care, but also make sure that we talk about who are the actual experts and what each one of these clinicians' jobs truly are. So what are your thoughts? Provider, clinician, call it out as an MD, DO, nurse practitioner, PA. What are you guys' thoughts as a patient and as a medical provider? Take care.